Doctors and surgeons of Reddit, what was your "this just got even worse" moment with your patients? Eye doctor here. You may have heard that diabetics need to have their eyes checked regularly because diabetes is actually a blinding condition. This happened probably about 15 years ago, but this patient of mine I had noted had severe diabetic vascular changes against the retina and required laser intervention as soon as possible. Without getting into the socio-economic arguments here, she scheduled her surgery and on the day of the surgery decided to take a work day instead of her surgery. Her job was cleaning, and on that fateful day, she inhaled some of her cleaner fumes which caused her to sneeze, spiking her blood pressure, and she blew the fragile blood vessels in both of her eyes wide open and blood started gushing into her eyes. As you might imagine, blood is opaque. You can't see through it. She was instantly and completely blinded in both eyes in a matter of seconds. It took 3 years, multiple surgeries, and a complete lifestyle change, but this patient did recover to have actually fair, but not good, vision. I still see her now for her annual visits. So many. The 80-year-old who came in with a self-inflicted shotgun wound to the chest. As we are fighting to get him stabilized and the surgeons are working to plug all the holes, none of us can figure out why the guy keeps oozing blood. Then we find out that he had intentionally overdosed on blood thinners before shooting himself. We kept him alive long enough to let the family come into the OR and say goodbye. The 45-year-old who came in via private car, family drove him in, rather than an ambulance, after what was described as a head injury. We realized how bad it was when someone noticed a plastic grocery bag lying on the patient's belly. It contained the brains that the family managed to scoop up, in the hopes that we could reimplant them. The 30-something meth addict who also had a permanent catheter infusing life-saving medication directly into his chest for pulmonary hypertension. He came into the ICU with pH crisis, and then we found out why. He had been injecting meth into the catheter, creating a hole through which his life-saving medication leaked out. Medicine is a lot of things. Sometimes it's just tragic. I have many stories. One is a healthy 23-year-old male comes into ER with some chest pain. Normal vital signs, never smoker, normal chest X-ray. Pain started after eating something spicy, tell him it's probably GERD. 5 minutes later he drops dead in his bed. Start CPR and get a pulse back. Stabilized, get CT scan and has an aortic dissection, dies again in CT scan and never makes it to the OR. The guy's major blood vessel basically just exploded. This happens to men in their 70s with a long smoking history and high blood pressure. This healthy 23-year-old had absolutely zero risk factors for this, no evidence of Marfan's or Ehlers-Danlos for the med people reading this. Still makes no sense to me. Was he sitting there calm with normal vitals and an aortic dissection? My father went to hospital with chest pains, they decided to do an angiogram. Dye injected, he's lying under the machine and the surgeon suddenly changes his procedure. Are you okay, feeling well? Any blackouts? No, he replied, just pain. A few more docs come in and are looking at the screen. They take him to another type of X-ray machine and again are looking in bemusement without explaining anything. You have a blood clot the size of a golf ball floating free in your heart, it's bouncing around the valves and we would expect you to have died very quickly from this. So they give him super strong clot busters, but were concerned it might shrink enough to get jammed. A lot of experts turned up. But all went well and he had a triple bypass a few months later. That was 30 years ago, he's 87 now and can walk with ease up AT pills. I got this information from the surgeon relating to my father. My father was diagnosed with an umbilical hernia from external observation and scheduled a surgery based around this information. When opening my father, they discovered that what appeared to be a hernia was actually cancer that was determined later to be stage 4 cancer that started in the appendix. This was really saddening as my father had believed he had the hernia for several years, but waited until it started hurting before doing anything about it. Patient came complaining of swelling in face. We suspected an abscess from a sick tooth. When they came, we called 911 immediately because the swelling had almost completely cut off her airway and her O2 level was an 87. A PSA to all: if you have a cavity or a broken tooth, it is a big deal. A rotten tooth can absolutely kill you. Not a doctor or surgeon, but a patient. I went into my GP with a swollen throat. No big deal, just some antibiotics and numbing spray will do the trick for strep. Well, it wasn't strep. I can still see the look on the doc's face when she felt my throat, looked down, and said, "I'm calling an ambulance to take you to the hospital right now." I had a cyst the size of a golf ball in my neck muscle, closing off my throat/airway. I thought the pain from swallowing and breathing was just from strep irritation. Turns out it's because even air was hardly able to squeeze through. How did it get there? Who knows? But it had to be removed immediately. Shit thing is, it happened again 2 years later, but got even bigger, even faster. I was gasping for air when they rushed me to surgery the second time. Now I'm just missing a huge chunk of muscle in my neck, to lower the odds of it happening again, since no one knows why it happened. I have limited neck movement now, and get regular neck cramp/painful tightness if I open my mouth too wide, yup, like yawning. TLDR, what I thought was strep throat turned out to be a massive cyst in my neck, blocking my throat and airway. Went from a normal GP visit to an emergency surgery. Happened again 2 years later. Not a doc, but I used to work for radiology in a small hospital and was there kinda Mr. Everything we don't want to do: lifting, security, transport, babysitter, etc. A young mid-20s couple gets brought in on backboards after a car wreck. Middle of February, ICAF, and the guy rolled the car. The girl gets a bed in the ER. She's mostly fine, beat up quite a bit but still coherent and talking. A state trooper is in her room with her. The dude is complaining but overall seems fine. She's asking me to see him and I tell her that they're stabilizing him and he's not going anywhere. She says, "What does that mean?" Over and over again, and I tell her that he's in a bed on a board, so he can't move. She's freaking out. I take the guy back to radiology, he's talking and joking, things seem fine. We do the CT and his spine is broke, not just broke, severed. Guy is in for some serious surgery, rehab, might never walk again kinda stuff. The girl runs out of the room, cop chases after her, they start fighting. A little 110 pounds girl is straight up squaring up with this big ass cop. Cop ends up tasering her in the middle of the ER. Her dude is screaming because they told him about his spine. His girl is now chained to a bed. Turns out they were running drugs, high as eagle balls, flipped the car and the dude probably never walked again. I always wonder though. Pick one. These were all from my intern year in general surgery in the late 90s. 1. The beautiful 34-year-old woman who manned a grill for 2 days during some sort of weekend festival for her church. Her eyes got irritated from the smoke off the grill, so she asked her PMD for some eye drops. After using them for 2 days she developed a rash. They were tobramycin drops, that rapidly progressed to cover her whole body. She developed TENS, aka toxic epidermal necrolysis syndrome, which essentially means the most superficial layer of the skin, epidermis, separates from the deeper layers, dermis. This leaves a wound that is similar to the raw spot underneath a big blister, but in her case it involved nearly 75% of her skin. She also developed GI bleeding, as the mucous membranes, the moist tissues that line the inside of your mouth, esophagus, stomach, and intestines, also separates and bleeds. At the time we had silver impregnated dressings, Acticoat, that we had to wrap her in like a mummy and change every day. Despite everything we could do at the main burn unit in a huge metro area in the Midwest, she died. 2. The husband and wife who were brought in at the same time, both with major flame burns. He was about 50% TBSA, total body surface area, and she was 75%. The woman was intubated at the original ER they went to. Big burns are literally hot potatoes and will get transferred to the nearest burn center ASAP when they arrive in a small town ER. She was waking up a bit when she got to our unit and kept trying to mouth something around her breathing tube. I'm pretty sure it was my baby, as she miscarried about 36 hours after she was admitted. Her nurse found the fetus in her bed. She developed an arrhythmia while we were starting a new central line, big 4 in the neck or chest, and we couldn't stop it. And she died. We later found out that the husband put their 2 kids in the car, then went back inside and choked her till she passed out, and then poured gasoline all over her and lit her on fire after he found out she was pregnant with someone else's baby. He also caught on fire. Gasoline will do that. He survived, got multiple skin grafts and went to jail. The kids were uninjured, physically. I'll stick with my boring office job. Obligatory, not a doctor, but I was a forensic technician assisting forensic pathologists at autopsy. One day, the chief and I were doing 3 routine narcotic OD autopsies. Oftentimes with ODs, our doctors would let us, the techs, do the whole evisceration to save time, so all the doc had to do was to examine the individual organs. So on the 3rd decedent, she gave me the green light to start cutting. Once I had the chest plate removed, something didn't look quite right with his lungs. I called over the doc and she takes one look and goes, "I really hope you have your mask on as tight as it can possibly be." Her next words were terrifying. "That's tuberculosis." We immediately had to inform the Public Health Commission, kick everyone else out of the autopsy room, and convert our DECO room, where we primarily did the exams of decomposed people, and turn on the extra-duty ventilation system and had to complete the exam with the full PAPR kit on. That was fun. When we opened the abdomen of this woman in her late 20s up, the entire room instantly smelled like hot rotting flesh. The smell was like the swamps of Dagobah story for those who remember that piece of Reddit history. We were doing an exploratory laparotomy because she had such severe abdominal pain she couldn't sit still for a CT scan, and the X-ray just suggested some free fluid in the abdomen. A paracentesis, draining fluid from the abdominal cavity, didn't really do anything, so the surgeon was kind of going in blind. But her indication for surgery was the extreme pain and the rock-hard feeling of her abdomen. When he cut her open, he saw that she was going into multiple organ failure with a ton of tissue simply rotting. The smell enveloped the room instantly. Anesthesia was gagging. I ran to grab the peppermint oil to rub on our masks. The surgeon looked at the abdomen for about 20 seconds and said, "Well, anesthesia, I think she's about to crash. I imagine this pressure in the abdomen was the only thing giving her any blood pressure." She did crash, and she died there on the table. This young woman had been an extremely heavy meth user. Her mom had started her out using meth with herself when the girl was a teenager. They figured she probably got a bloodstream infection from injections with dirty needles, and that just spread through her body like wildfire. Edit: I'm the nurse that was present for the case. I wasn't in charge of any diagnostic testing or any preoperative/emergency care. Nurse here. Midwife let a mom go through over 8 hours of the pushing stage of birth to the point the mom went into severe decompensation, blood pressure plummets, saturation drops, fetal distress, etc. In Canada, midwives practice separately from doctors and nurses. They usually just have an agreement with hospitals to use the beds, although medical care is available if the delivery becomes high risk. Doctors take over and go in for emergency C-section. Realize the arteries in the sides of the uterus are ruptured due to pulling away from the strained uterus and extensive pushing. Baby came out fine, but they had to work on mom. Finally close her up only for mom's pressure to plummet again. They open her back up and realize another artery was bleeding, so they clamped her aorta until they could repair the damage. I.e., her lower body didn't receive blood flow for several minutes. They replaced her blood volume at least 3 times throughout. Finally the team stabilized her but were afraid of anything else unexpected, so they packed her but left the wound open, then sent her to ICU. I received baby in NICU. Baby was okay. Mom survived, although didn't find out much more.